Hey everybody, it's Dr. Michael with Lighthouse Chiropractic, and this month we're talking about Mythbusters. And one of the myths that people ask all the time is, hey, is it safe to go to the chiropractor if you're pregnant? Actually, the fact is it's very safe and it's very effective. When you're pregnant, it's the best time to go to the chiropractor. Today we're going to talk about why it's so great to go when you're pregnant and how do we make it safe. So when you're pregnant, first thing to remember is that you've already got some posture issues. The head's coming forward, and with the growing belly going forward like that, that's gonna really throw that center of gravity off. And so a lot of the moms coming in, they're already in a lot of stress and tension on their spine. So we know there's a reason to adjust people. In fact, you're getting a lot of symptoms. Neck pain, headaches, you might be getting low back pain, hip pain, and so it's really important to come see me. Now, what happens when you get adjusted when you're pregnant, and how is it different from getting adjusted when you're not pregnant? So the biggest difference is here at Lighthouse Chiropractic, the doctors are Webster certified. And that's a technique we use to make sure that we can take care of pregnant women, and it's very gentle and very safe. Our tables here are designed for the pregnant women. So I'm going to show you here as we set up our patient. These table pieces will actually drop into a place where the pregnant mother can lay face down and not have any pressure on her belly. And once she's in position, what we're going to see is that the technique I use, the Webster technique, is designed specifically to measure the pelvis of the pregnant lady to make sure that it's in alignment. Now, why is this so important? Simply because if the pelvis is in alignment, then the uterus is in alignment. And if the uterus is in alignment, the baby has the best position to grow and not have any constraint on them. So then the big question is, why is that important? Well, at the end, when it's time to deliver the baby, we have very little interventions. We have shorter labor and shorter delivery times. Now, who doesn't want that? So again, as I adjust the pregnant woman here, you can see I'm going to be using her legs to measure which way the pelvis is going. And as you can tell, when I make the adjustment, it's very simple and it's very small. There isn't any big movements in there, and it's not traditionally what you see where you're seeing a lot of adjusting where there's the cracking. So once the female's pelvis is all taken care of, then we can turn them over on their back, and you can see the table then back transforms into a regular flat bench, and then we can adjust the neck and the upper back as well. So once we finish the adjustment, the patient gets up. We want to make sure that everything is still moving better than it was before they came in, and you're going to see a lot of comfort and relief after that adjustment for the pregnant lady. So, is it safe? Yes. Is it effective? Yes. And absolutely number 3, it's very gentle. In fact, when the baby's inside of that uterus, whether it's from the first, second, or even the third trimester, remember, they're surrounded by water. So it's like taking a potato or even an orange, putting it inside a water balloon. There's a lot of protection around it. And so a chiropractic adjustment does not really disrupt anything inside the baby or the uterus or have any negative effect at all. And mostly it's all positive effect. So remember, shorter labor times with less intervention, improved recovery from labor and delivery, and healthier pregnancies and deliveries lead to healthier babies. And that's what we want, healthy moms and healthy babies.